It has been very common over the past few months for representatives of the US government in talking about the pandemic to completely downplay the threat of dying during this pandemic if you are younger than 50 or 60 or 70 years old. But many people in the lower age categories have died. In particular, certain communities have been very hard hit. And of course, frontline healthcare workers have from the very beginning of this pandemic been one of those groups. And joining us now to break down some of his recent research and writing around this area, Alastair Gee, reporter for The Guardian, joining us now. How's it going?
Thanks so much for having me, I'm good.
Thank you for joining us. You had an article profiling several of these frontline workers in their 20s and some in their 30s who have died as a result of this pandemic. Can you tell us a little bit about what you found in your research?
Yeah, so The Guardian and Kaiser Health News have been partnering on this really remarkable project to try and catalog every healthcare worker in America that has died of COVID-19 while working on the front lines. And the US government isn't doing a good job of tracking this data. And we found that unfortunately, it looks like at least 1,000 healthcare workers that we've identified so far, it seems have died of COVID, have been reported to have died of COVID, and we're investigating all of them. I looked at a specific subset of those, at these young healthcare workers, because we were finding in this list of over 1,000 names that there were surprisingly large numbers of younger people popping up. And in particular, we found at least 8. There are definitely more, but these are 8 that we could confirm people under the age of 30. And these were people who had their whole lives ahead of them, their whole careers ahead of them. Some of them still lived at home. They lived with roommates. I mean, they were very, very young people. But unfortunately, despite what we've heard about younger people being at lower risk, that may be true, but that doesn't mean that there is no risk. And these people that I profiled contracted COVID-19 while at work and died of it.
And I know that in some of these cases there might not be a great deal of information available, but is this simply a matter of, however low your chances are with enough people being exposed, some people are going to fit into that category? Are there cases where it seems like there was some other influence that led to this outcome? Well, what's the cause of this fact that some of these were incredibly young healthcare workers?
Well, healthcare workers in general, research has shown, are 3 times likelier to contract COVID just because of their exposure to it at work. And young people in this environment, there are certain risk factors for all people. Smoking, for instance, is one of them. Having respiratory problems or asthma. It's hard to tell in many cases. I mean, what we know, for instance, about one of the people that I profiled, his name is Joshua Obra. He was a 29-year-old who lived in Anaheim, California. Living in Anaheim, he loved Disneyland. He was in fact something of an influencer on Instagram thanks to all his Disney posts. He worked at a nursing home for people with dementia and Alzheimer's in particular and other cognitive issues. And there was a very, very large outbreak at his nursing home, and a total of 14 people died in his one nursing home alone of COVID-19. And so he had exposure at work. He worked with his sister, in fact, his younger sister. They both contracted COVID at the same time, and she survived while he didn't. Another healthcare worker that I profiled, his name is Dennis Bratt, and he had a very similar situation. He worked in an alcohol and drug addiction facility where there was an extremely large, or a relatively large, outbreak of COVID, and he was one of those who contracted it. And it's unclear why exactly he was the healthcare worker of many who worked there who died, but ultimately he and his wife did contract it, and he passed away after having been on a ventilator. And so what the story shows is really young people may be at lower risk, but with our healthcare workers who face so much more exposure than the general population, the risk is higher. And as one of the medical experts I spoke to told me, he said it should be unacceptable for us to have any young people that die of COVID in this country. These are people with their whole lives ahead of them. And yet the way that we have failed to get a handle on this pandemic has just exacerbated the risk for these young healthcare workers.
Yeah, to go back to the first statistic that you mentioned, I think that for a lot of Americans, if you had told them on day one, whatever day that was of the American, version of this pandemic, that 1,000 Americans would die, they would have thought Well, that by itself is horrific. The idea that that's just the healthcare workers that have died, that really puts it into perspective. Over the past few months, there's been a lot, especially up until a few months ago, of people talking about how much they owe to these healthcare workers, and talking about them being heroes and things like that. Did you get the opportunity to talk to many of the people who've survived this and get an impression of what they think about the response? Do they feel like they've been prioritized or protected? How do they feel about the way that the social view of this pandemic has evolved over time?
They simply think that people are not taking it seriously enough. I spoke to the surviving relatives of the two people I mentioned, and they've been making Facebook posts, Instagram posts saying, look, it can happen to you. Take it seriously, wear a mask. This is real. This is not some, I don't know. It's not blown out of proportion, they say. And yeah, they are, some of the ones that I spoke to are angry at the way that the system has failed to respond. And I think it's unequivocal that we are simply not prepared to handle this pandemic. If you look at, for instance, some of the supplies that the federal government has been shipping to nursing home healthcare workers, for instance, it's been widely reported that these supplies they're basically shipping, instead of a protective gown, they're shipping a plastic bag without armholes. They're shipping insufficient masks, as we've reported. And so the government is simply is not doing what it should to protect these healthcare workers. And we can only hope that is starting to shift.
I don't know that if you've read the Washington Post reporting about the Trump administration apparently pursuing, not in a public way, but pursuing a herd immunity strategy recently, while saying that they're going to be doing what they can to protect vulnerable populations, such as those in nursing homes. It sounds like, from what you're saying, in terms of the focus on nursing homes, that protection doesn't seem to be coming in terms of supplies, protective equipment, and things like that.
Well, the problem with the herd immunity strategy is that you have very large casualties in the pursuit of pursuing it. And that's why, in The Guardian, we've reported on this. People say that it's simply unethical to pursue that kind of approach because there will be casualties as a result. There were reports early on that the UK actually was pursuing a so-called herd immunity strategy before reversing course, I think, for the reasons I've mentioned. It's simply, how many deaths are you willing to have on your conscience if you pursue such a strategy? Because that's inevitably what it will entail.
Exactly, and not to mention that, like, from the perspective of the Trump administration, as someone who's been very critical of their response from the very beginning, it seems shockingly like just not doing anything and applying a label to it that sounds vaguely scientific. That's what it feels like to me. For more political news, breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/The Damage Report. And you can ring the bell wherever it is so you don't miss anything.